Good afternoon, fellow classmates. My name is Meagan Hoberman, and I've been a certified nursing assistant for the past 6 years, and I'm currently pursuing my degree in nursing here at Meagan College. I've been working on a subacute rehabilitation unit for the past 3 years, and when I first started on rehab, we were getting patients coming in that had very simple diagnoses, like a minor surgery or minor illness, and they were coming to us to get a little, get a little bit of physical therapy or a little bit of occupational therapy to get them back to their baseline functioning status so they can go home. Recently, we've been getting a lot more patients in that have very complex diagnoses that were often terminal, like end-stage Alzheimer's or dementia, or cancer that metastasized to the brain. I was recently talking to my nurse about this, and we were talking about how sad it is to see the family members come in and think that the family member is going to get better, but unfortunately we don't think they would. And my nurse made a really interesting remark. And she said one of the biggest problems she thinks future nurses like myself and many of you are going to face is actually the lack of education and resources in the area of comfort care for patients and their families. So that got me thinking about what comfort care is, what comfort care encompasses, and how we can better educate ourselves to help families in this type of situation. Because unfortunately, we're probably going to have to deal with something like this eventually. Now, according to the American Medical Dictionary, comfort care is the overall treatment of a person with a terminal illness, or the overall treatment of a person with a terminal illness that denies life-sustaining treatment. Now, there's two main forms of comfort care. One of them is hospice, which is the more popular one. A lot more people know about it, which focuses on the overall treatment of the quality of life of the person with a terminal illness, or palliative care, which is the overall focus of pain management in a terminally ill patient. The comfort care kind of encompasses hospice and palliative, but before they're put fully on comfort care measures, they might just be one or the other. And there are certain criteria that a patient has to be functioning at to be considered on hospice or on comfort care. They can't just walk on and say, hey, don't want to do it anymore. There's certain criteria that the patient has to meet and has to be improved. Now, comfort care, palliative care, and comfort measures can be delivered in a range of settings. In the comfort and security of someone's own house or an agency, if they're newly diagnosed at a hospital or the nursing home facility, if they're a resident there. I didn't realize what a controversy comfort care was, and how a big part of people's fear of comfort care is actually from the lack of support from doctors or from medical healthcare practitioners. 59% of doctors do not support comfort care as a valid treatment for terminal ill patients. Often the thought is, with advances in medicine like artificial hydration nutrition, dialysis, organ transplantation, chemotherapies, radiation, or even a combination of the two, we have no right to decide when, how, or why somebody's going to die. It's our job to provide an adequate treatment to sustain their life. Another staggering 60% of doctors or other healthcare practitioners said that they would not even offer comfort measures as an option to a terminally ill patient. They could not willingly give them information or support them as their doctor if they chose this sort of treatment because they don't believe in it. One of the biggest things with why families don't agree with it is the lack of support from doctors. You know, if somebody's telling me my sick mother can come through and do it and it'll be great, then why would I give up on her? The feeling of guilt and anxiety, animosity of having to give up on her would be horrible to have to live with. No family member should have to live with that. Another thing is, they don't understand the actual suffering that people have to go through. I myself did not realize till very recently how painful cancer could be. And you're putting 80, 90-year-olds with brain mets, as we call it, brain cancer with metastasized with chemotherapy and radiation, knowing what horrible side effects chemo and radiation have is very tough. The family doesn't understand, like I said, how painful it is, what kind of side effects from radiation are, and they don't have an outlet to turn to explain it to them. I recently had a patient in that situation that was a husband and wife. The husband was supposed to have a procedure. He didn't want it. The wife begged him to do it for his health. And he did. And he had a 1 in a million reaction to it. He landed in the hospital with a breathing tube, with a G tube, with artificial nutrition hydration. He named it. He had it. And he could respond to stimuli. He blinked once for yes, twice for no. He verbally couldn't talk to you. And the doctor said, keep sticking with it, he'll be okay. So the family thought that they were doing the right thing by keeping him on. The wife didn't want him on. And the wife was fighting the family. And the whole time, the guy was pulling out his tubes and pulling out his IV on a daily basis. He just did not want this for himself, but he couldn't verbally express it. And the guilt that the family was putting on the mother was really tough. It was a very hard thing. He ended up passing away, and I actually took care of both of them, and I was talking to the son, who was really tough. And he had said, I just talked to a holistic practitioner about what my dad had gone through, and I didn't understand how much he was suffering. I thought the doctors had the best interest, and that's it, and I don't know if I could have done it again had I been in a different situation. And he had filled with the guilt because he's been told by doctors who have the best interest at heart that he made his father suffer. And it was very sad to see. One outlet that one group of people, shockingly, that are stepping out is the government. They're trying to recognize comfort care as a valid form of health care. They offer numerous education programs on comfort care, what encompasses, how it encompasses, not just for the patients, but for the family. So, in 2009, the state of Connecticut actually had Medicaid approve a stipulation that if you're diagnosed over 7 years with terminal illness, they will pay for comfort care. And they're also using the personal testimonies of, like the example I just said of the son, who said if somebody would have explained it to him better, he would have chosen differently. I think that as future nurses, or even as a family member, it's very important that we understand every aspect of care. And we have to understand that we are going to be put in unfortunate situations that we don't agree with or we don't like, but we have to focus on the end result, which is what is best for the patient. And we need to be supportive of them and just give them the best and get the best education we can to offer them in such a tough situation. Thank you.